The report that we've done on the economic crisis, health systems and health came out in March 2013 as part of the series of the Lancet on Europe. And together with our colleagues, Professor Martin McKee and Dr. David Stuckler, and colleagues from the European Observatory on Health Systems and Policies, we've looked at the impact of the financial crisis on health and on health systems. The main outcome of the report is that we saw that now the effects of the financial crisis are already visible. They're reflecting on the population health, specifically mostly on mental health. We see that in countries which already are showing historic departures from the historical trends in terms of rates of the suicides, and we see that in the United Kingdom, in the United States, in Italy, in Spain, and also most recently in Greece, when the 2011 data was released and showed 45% increase in suicides. Also in this report we find that different countries were prepared differently to the crisis, and their health systems of some countries were prepared better than others. Some had measures in place before the crisis that helped them to counteract the recession. We also find that systems of social protection help to mitigate some effects of the crisis. And from the previous research, we find that in countries that spend more on active labor market programs, they help to counteract the increasing suicide rates. For example, countries in Scandinavia don't see an increase in suicides when they're going through the recession. Another finding is that there are alternatives to the austerity measures. There are alternatives to the cuts, and the case of Iceland is showing us that, where they rejected austerity measures and opted for protecting social welfare and public health. We see that Europe presents a sort of natural laboratory for doing research right now, because it was hit by a similar set of economic shocks, and different countries had different policy responses, but which led to differing health outcomes. So we find that now is a good time to distinguish the different effects of the crisis and how different policies affect health.